Right now, somewhere in America, a senior is sitting at her kitchen table, opening a Medicare Advantage statement. She's looking at a $0 monthly premium. She's seeing the free gym membership, the free grocery card, the free dental coverage. And she's thinking, wow, what an incredible deal. These insurance companies must really care about seniors. Yeah, let me stop you right there. That Medicare Advantage plan isn't free. It's never been free. You're paying for it, every month, through your taxes, through your decades of Medicare payroll contributions, through your Part B premium that comes out of your Social Security check before you even see the deposit. You've been paying for that free plan for 40, 50, 60 years. And here's the part that should make you furious. Behind closed doors, the insurance companies running Medicare Advantage just got an extra $13 billion in federal payments approved this year. Your money, funneled through the federal government, straight into the pockets of United Health, Humana, Aetna, CVS, and the other big players. And you're not seeing a dime of it. Not unless you fight for it. In the next few minutes, I'm going to show you exactly how Medicare Advantage actually works. Not the marketing version, the real one. I'm going to expose the hidden ways these plans extract money from the system while quietly limiting your care. And near the end of this video, I'll walk you through the Medicare Advantage Maximizer playbook. The specific moves to make right now so you actually get every dollar of the benefits you've already paid for. Hit subscribe right now if you're over 60. This is exactly why this channel exists. All right, let's get into it. So let's start with the truth about how Medicare Advantage gets paid. Because once you see this, you'll never look at a $0 premium plan the same way again. When you sign up for a Medicare Advantage plan, the insurance company doesn't actually need your monthly premium to make money. They get paid directly by the federal government, by Medicare itself, for every single enrollee they sign up, every month, like clockwork. The formula for how much they get is complicated, but here's the range based on publicly available CMS data. If you're a relatively healthy senior in an average cost part of the country, the insurance company is receiving roughly $500 to $800 a month from Medicare just for having you on their rolls. If you have multiple chronic conditions, that payment jumps to $1,500 to $2,000 a month. If you're in a high-cost region with significant health issues, the per-enrollee payment can hit $20,400 or more. Read that again. Per month. Per enrollee. So when the plan tells you they're giving you a $0 premium, a $100 grocery card, dental coverage, vision, hearing aids, and a gym membership, they're not giving you anything. They're handing you back a sliver of the $600 to $2,000 a month that the federal government is paying them to enroll you. The rest is profit, administrative costs, marketing budgets, and shareholder returns. That's how a company can offer a $0 premium plan with all those bells and whistles and still be one of the most profitable health insurance lines in America. They got your money before you ever walked in the door. And here's where the $13 billion comes in. Earlier this year, the federal government had been planning to reduce per-enrollee payments to Medicare Advantage plans because the system was being overpaid by tens of billions of dollars compared to what equivalent original Medicare coverage costs. The plans pushed back, hard. Their lobbyists flooded Washington, and the final rate notice reversed course. Instead of cutting payments, the government added roughly $13 billion in additional payments to Medicare Advantage insurers this year. That's $13 billion of taxpayer money, your money, going to private insurance companies. And almost none of that translates into expanded benefits for you. It translates into bigger profits, more aggressive marketing, and more rural plan exits, because the companies keep the money and pull out of any market where their margins aren't fat enough. Now I want to be clear, I'm not telling you to drop your Medicare Advantage plan. For some seniors, it's still the right fit. What I'm telling you is, you've paid for everything that plan offers. Stop treating it as a gift. Start treating it as something you're owed, and start using every single benefit they offer before the year ends. That's what we're going to do for the rest of this video. The Medicare Advantage Maximizer Playbook. 8 specific moves to get every dollar you've already paid for. Move 1. Use your Flex card or grocery card before December 31st. If your Medicare Advantage plan included a Flex card, grocery card, or over-the-counter spending card this year, those benefits expire when the plan year ends. Medicare Advantage plans operate on a January 1st to December 31st cycle. Whatever's loaded on your card on December 31st at 11:59 p.m. is gone the next morning. Some plans roll a small amount over, most don't. I'm shocked at how many seniors I hear from who say, "Oh, I got a card in the mail, but I didn't realize what it was for." That's $100 a month of grocery money, $200 a month in some plans, thousands of dollars a year. Pull out your enrollment paperwork tonight. Find out if you have one of these cards. Find out the balance. Use it. Move 2. Get every preventive service before year end. Your Medicare Advantage plan almost certainly covers annual wellness visits, mammograms, colonoscopies, bone density scans, flu shots, shingles vaccines, and a long list of other preventive services. Most of them are free with no copay, and the benefit resets January 1st, meaning whatever you didn't use this year you can't carry forward. Call your primary care doctor this week. Ask, "What preventive services am I eligible for that I haven't used this year?" Schedule whatever you can. This is the lowest effort, highest value money you'll ever recover. Move 3. Use your dental allowance strategically. Split it across 2 plan years. This one is brilliant and almost nobody talks about it. Most Medicare Advantage dental benefits are capped at $1,500 to $3,000 per year. If you have major dental work needed, say $5,000 worth, you can't get it all covered in a single year. But you can split it. Talk to your dentist. Tell them you want to do the lower jaw work in late December using this year's allowance, and the upper jaw work in early January using next year's allowance. Most dentists will gladly schedule it that way. You just doubled your dental coverage by timing the procedures around the plan year boundary. This works for almost any capped benefit: dental, vision, hearing aids. Time the work strategically. Move 4. Verify your doctors are still in network, today. Here's a brutal trick most seniors don't know about. Medicare Advantage networks are not static. Doctors leave networks, plans drop providers, and the marketing materials don't update in real time. Earlier this year, Medicare had to issue a special enrollment period for thousands of seniors who signed up for plans based on official Medicare.gov network information, only to discover their doctor wasn't actually in the network. CMS calls these ghost networks. Plans advertise providers who don't actually accept the plan. Go to Medicare.gov today. Log in. Look at your plan's provider directory. Then, and this is the critical step, call your doctor's office directly. Ask, "Are you still accepting my specific Medicare Advantage plan in 2026? Don't rely on the website. Don't rely on the plan's app. Call the office. Confirm. If your doctor has dropped out, you may qualify for a special enrollment period to switch plans. Don't accept losing your doctor as the cost of doing business. Move 5. Ask if you're an inpatient or under observation. Every hospital visit. This is one of the most expensive traps in all of Medicare. If you go to a hospital and stay overnight, you might assume you've been admitted. You probably weren't. Hospitals increasingly classify overnight stays as observation rather than admission. The difference costs you thousands. Inpatient admission is covered by Medicare Part A. Most costs are absorbed. Observation status is covered under Part B, meaning you pay 20% of each individual service separately, plus the cost of any medications you receive during the stay. People who thought they were admitted have walked out with $5,000 to $15,000 in surprise bills. Every single hospital visit, ask the doctor or the admissions desk, "Am I being admitted as an inpatient, or am I under observation status?" Get the answer in writing if you can. If you're being held under observation longer than 24 hours, push back. Ask for inpatient admission if appropriate. Your wallet depends on it. Move 6. Fight prior authorizations. Don't accept the first denial. This is where Medicare Advantage actually limits your care in ways original Medicare doesn't. If you have original Medicare with a Medigap policy, your doctor orders a test, you get the test. Done. With Medicare Advantage, the doctor has to ask the insurance company for permission first. The insurance company can say no, or delay, or require additional documentation, or send you to a less expensive alternative. Studies have shown that roughly 80% of Medicare Advantage prior authorization denials get reversed on appeal. 80%, which means the initial denial is almost never the right answer. It's a stalling tactic. The plan is betting you'll give up. Don't give up. Every Medicare Advantage plan has a formal appeals process. The first level is reconsideration. The second level is independent review. The third level escalates to an administrative law judge. Each level has a deadline. Most denials get reversed by level 2. If your doctor says you need a treatment, fight for it. Get the denial in writing. File the appeal in writing. Document every conversation. The system relies on you quitting. Don't quit. Move 7. Apply for extra help if your income is low to moderate. This one almost nobody talks about, and it can save you thousands a year on prescription drugs. Extra help, also called the low-income subsidy, is a federal program administered through the Social Security Administration that helps cover Part D prescription costs for people with limited income and resources. In 2026, you may qualify if your annual income is below roughly $23,000 for an individual, or $31,000 for a married couple with limited assets. If you qualify, your prescription copays drop to a few dollars per medication, sometimes zero, and you avoid the donut hole entirely. Most eligible seniors never apply because they don't know it exists. Go to ssa.gov and search Extra Help, or call 1-800-772-1213. The application is one of the easier ones the SSA processes. If you qualify, the savings start immediately. Move 8. Take advantage of Part D smoothing, automatic in 2026. This one is brand new and most seniors don't know it kicked in. In 2026, the maximum out-of-pocket cost for Part D prescription drugs is capped at $2,100 per year. Great news. But here's what's even better. There's a new feature called the Medicare Prescription Payment Plan, or smoothing. Instead of paying that $2,100 in a single big hit in January or February when your expensive medications are filled, the plan spreads the cost evenly across all 12 months of the year. So you pay roughly $175 per month instead of $2,100 up front. For 2026, this is automatic for people who hit the cap quickly. You don't need to apply. But you should check with your Part D plan to make sure you're being smoothed. If you've been paying large prescription bills in early months, call your plan and ask about it directly. That's the Medicare Advantage Maximizer playbook. 8 moves. All of them recover real money or real care that you've already paid for through decades of Medicare contributions. Here's your 3 steps for this week. Step 1. Pull out your current Medicare Advantage plan paperwork tonight. Identify every benefit you haven't used yet. Flex card balance, dental allowance, vision allowance, hearing aid benefit, transportation credits. Make a list. Step 2. Call your primary care doctor's office and verify 3 things. 1. That they still accept your specific plan in 2026. 2. That you have no preventive services left to use this year. 3. That any prior authorizations on pending procedures are submitted and not languishing in denial limbo. Step 3. If you're nearing the annual enrollment period in October, start now to review whether your current plan is still the right fit for 2027. Don't auto-renew. Plans change every January 1st. Same name, same company, but the benefits, network, and formulary can all shift. The plan you loved last year may not be the plan you have next year. Look, I'm going to be straight with you. Medicare Advantage isn't inherently bad. For some seniors, it's a good fit. But the system is structured so that the insurance companies win by default and the seniors win only if they fight. The companies take your federal payment, market aggressively, then quietly limit care through networks, prior authorizations, and benefit caps. The only seniors who get the full value of what they've paid for are the ones who know the rules and use every tool the system makes available. That's the whole point of this channel. To make sure you walk into your Medicare decisions with your eyes wide open. Not as a beggar grateful for free benefits, but as someone who's paid into the system for decades and deserves every penny back. If this video helped you, hit the like button so YouTube shows it to more people who need to see it. Subscribe so you don't miss the next update. And share this with someone you know on Medicare Advantage. Your spouse, your parents, a friend. Half of them have unused FlexCard balances right now and don't even know it. In the next video, I'm walking through exactly how to file a Medicare Advantage prior authorization appeal, line by line, with the specific language that gets denials reversed. Make sure you're subscribed. I'll see you in the next one.